what does it mean to have an ESR1 mutation? What is an ESR1 mutation and how does it happen?
Right. It's I think ESR1 mutations are one of these novel discoveries that really changed how we understand breast cancer care. And interestingly, a lot of that work was actually done at Baylor College of Medicine. The team studied endocrine resistance for a long time. So I would like to think of ESR1 mutation as the same way you think of an antibiotic resistance, right? You get a bunch of bacteria, they're sensitive to an antibiotic, and then eventually they become resistant. Well, how did that happen? Well, one of them might be resistant to the antibiotic, and then you select that one out. And in a similar way, that's what ESR1 mutations look like. And that's why they have the term emergent, because they emerge. They're not there. And in fact, if you look at the research, when you see an endocrine, an ER-positive breast cancer patient, they're almost never, at the beginning of their therapy, they almost never have any ESR1 mutations, like less than 1%. Someone walked through the door, new diagnosis. But then, you give them endocrine therapy, you're killing all the endocrine sensitive cells, and at some point, some of the cells might have that abnormal configuration at one or another particular point mutations. And then what happens is they become what's called ligand-independent. So that means, aromatase inhibitors lowers the ability of the cells to kind of receive estrogen, that it's not, decrease in the estrogen produced. But and that's the ligand, right? But the ESR1 mutation makes the estrogen receptor active, even if that ligand estrogen is not there. So as you're depriving the body of the estrogen by using aromatase inhibitors more and more, you're essentially soliciting more of these abnormal cells to survive, and the other ones that need the ligand will die off. So with the treatment, you get more emergence of ESR1 mutation. In the metastatic setting, at the first line, somebody, who just got diagnosed with ER-positive advanced breast cancer, there'll be about 5% chance of having an ESR1 mutation. But then you throw aromatase inhibitors, you throw your endocrine therapy, and by the second line, they're almost 40%. So this is how ESR1 mutations work. Now, there are actually different flavors to ESR1 mutations. There is what's called fusion mutations. There are point mutations. There are different types. Some of them are more ligand independent, more active than others. But they all share the fact that they make the cell, the endocrine program active, independent of estrogen. Now, that's a problem, because what are you going to do for these cases, right? I mean, you get you have a patient walk through the door, and you do a testing, and you find an ESR1 mutation, which means that if you throw standard endocrine therapy at these patients, they're just not going to do well. So this is the current landscape of what the mutation has been.
Shout out to Dr. Suzanne Fuqua. She's the one who discovered ESR1 mutation at Baylor. She was one of my prior mentor, and I greatly value her insight. But you're right, all ESR1 mutation don't come in one flavor, right? So there is multiple different ESR1 mutations. Historically, about 50% are this D538G mutation, and this one, Fulvestrant, does have some activity against. But the other 50%, you have those Y537S, C, and N. These are the one where Fulvestrant has no activity essentially against.